in some center, we have decided to put this down just to be able to guide you successfully. If you look at this very well, some center we have it, some center may not. So you can see small, medium, large. Alright, welcome to NMC OSCE channel, a channel where we guide you through your OSCE journey. We want to make OSCE as easy as possible for you. We want to help you to be able to achieve that your all-important UK RON dream. Now, with that being said, I just want to quickly guide you through how to wear your PPE as it relates to your OSCE. Basically, in your OSCE station or in your OSCE center, we're going to be using a mini session of our assessment center here just to demonstrate to you how it should be like or how it should be done. Now, when it comes to wearing of PPE, you must know that the essence of wearing PPE is to protect you and also to protect the patient. So always have that at the back of your mind. Very, very important. Now, we've already demonstrated how to perform hand hygiene, and that video is already available to you. You can decide to set that through from the EMGS channel, and then you can watch it to be well acquainted. So we are just going to be focusing on how to wear your PPE. Now, I want to sound this. It's very important for us. I want to sound this very important for us that you practice all these things step by step. Don't rush. There is stages. There are steps towards achieving your journey. Nobody is born walking. Everybody starts with from crawling to sitting down, and then so on and so forth. So this is not also a replacement of our classic lectures where we are more detailed, but we just want to do a little bit of demonstration to further enhance your journey. Now, with that being said, in your OSCE center, you are going to be carrying out your PPE wearing in two basic phases. So depending on the center. Some center will just have the PPE right on the table. You will see your glove, you will see your apron available to you. You may not necessarily need your goggle. The reason for that is most of the procedures that usually need goggles, such as suctioning, have been removed. So don't bother yourself with that. So you are basically going to be wearing your glove and apron. And remember, this always begins after you have performed your hand hygiene and always end after you have also performed your hand hygiene. So before you start your wearing of PPE, you perform your hand hygiene following the WHO standard. And then after you have worn your PPE and it's not time to take it off, you also perform your hand hygiene. Now back to wearing of PPE again. So in some center, we have decided to put this down just to be able to guide you successfully. If you look at this very well, some center we have it, some center may not. So you can see small, medium, large. So these are where gloves are going to fit in. So small, medium, large, that means large glove will be here, medium gloves will be here, and so on and so forth. So at the bottom, you're going to have your apron well fitted here. So please take note of that. Nobody should be confused on that day. We always recommend NGS that you should either choose your medium glove or your large size glove. You don't want to go and be struggling on the day of your exam. You want to ensure that things are done right. Remember, time is an enemy in your exam. We also know that time is an enemy, but don't chase the enemy now. For now, focus on practicing if you are a beginner. But if you know your exam is quite close, you can then speed up as time progresses. So this has been explained before. It's where you are going to have your hand sanitizer positioned. So it will be attached to the balls, this equipment that I've shown before, and it will be mounted on the wall. So some center may not have it that way, it might not be on the table. But at ENGS Physical Assessment Center, we don't want to leave any stone unturned. We want to ensure that you have all the standard equipment that you need for your practice. So whether you are joining us in our online lectures or offline lectures or in our Physical Assessment Center, we want to be sure that you get quality and you are able to go there and smash your exam. Mind you, you are dealing with real life persons after your exam. So why not do it the right way? So after you have done that now, you have performed your hand hygiene, it's time to wear your glove. Remember, the first thing to do before even wearing your glove is to what? Wear your apron. So if you are picking your apron from the equipment, good and fine. Sometimes it might just be on the table. At this time, I have placed my apron on the table just for demonstration purpose. Now, how do you wear your apron? So this is my apron. Mind you, this is not what will fail you because you did not wear your apron the way I'm wearing it, but this side is supposed to be worn. So you put your apron on like this, and then you can slide down just to open it up. You can see, and then I can tie it. So you can tie it whichever way you want. So I have put on my apron and I have tied it, and you can tie it here whichever way you want. It doesn't really matter. All that matters is you have put on your apron successfully. Now, with that being said, the next will now be for you to what? Wear your glove. Now, before wearing your glove, always validate your glove. Now, the expiry date of most of your equipment will either be on the side or at the back. So either on the side or at the back. So for this glove, the expiry date is at the back. So you just validate it, expiring 19th of 7, 2029. So for those of you that may not have known how to validate your equipment, we've done this multiple times in class. There is a bear sign. So that bear sign is a guide for you to know where your expiring date is for your equipment. So if you look at this closely, you will see the bear sign. So you pick your full glove, and when wearing your glove, it's also very easy. Don't stress yourself. And when you take your time to do this, over time it gets used to you. You can be rushing. So first thing for you to watch out for is your thumb. Once your thumb gets it right, every other thing follows. So with your thumb getting it right, you want this, and then for the second one, you also control your thumb. With your thumb getting it right, whether you are doing AMTT, whichever procedure you are doing, with your thumb getting it right, others have no alternative but to follow. So after you have successfully worn your glove and apron, you will carry out your procedure. Now, having done your procedure, it's time to get rid of your glove and apron. Mind you, when we began, I told you that the first thing to wear was going to be your what? Your apron. This time, reverse is the case. Why? Because this your hand is now soiled. So you don't want to start using soiled hand to touch yourself. It will not be nice. So you will now start discarding from your what? Your glove. So how do you do that? You pick your glove from the inner part. You pick it from here, because if you are going to pick it from here, you are going to basically be staining yourself with your hand that is contaminated. So you pick it from the inner end, and then you can slide it out. You can see how I just did it. And then this hand is relatively clean, although it still needs to be sanitized or washed with soap and water. But you can now use it to pick in here, pull out what you see, then you can discard this in your clinical waste. So I will go ahead now to discard this in my clinical waste. That is done. So you can also now go ahead to take off your apron. Taking off your apron is very easy. You can decide to cut it from here first, and then you pick it from here, and then you can now roll it in, and then you also discard in your what? In your clinical waste. So having done that, you will now go ahead to perform your hand hygiene, following the step we have already explained to you. So that's basically it for the steps involved in the wearing of your what? PPE. So as I said before, at NMC OSCE Masterclass, we want to help you to ensure that you achieve your UK RON dream. So whether you are so busy that you feel you cannot achieve it, or whether you want to practice among people of like mind, ENGS will be able to support you. You can contact our customer care on WhatsApp, and then we'll be able to provide you all the necessary support that you need to aid your RON journey. So we wish you the very best, and we hope to see you in the next video. If this video was useful to you and you like what you saw, try to subscribe to the channel, and if you have your colleagues that are also on their journey, try to share this video to them. It will go a long way in helping them. It's not a replacement for the class, as I said before, because you are going to be dealing with real life patients. and we want to ensure that you get quality tutorial that will boost your confidence, that can aid you in smashing your OSCE. See you in the next video. Otaibi Egis, sign off.